viongozi wetu watimize majukumu yao kwa haki. Nidhamu, bidii na ubora ndiyo kauli mbiu yetu siku zote. Utawala sisi na mali watu wenye ujuzi na ubora wa juu katika sekta ya afya. Malaika imepewa mitindo na maadili. Ee Mungu Baba, twakuomba utujalie siku zote sisi wana wako ufundishaji, utafiti na ushauri viwe bora katika chuo. Ee Mungu Baba, twakuomba kibariki chuo chetu. Rafaeli Malaika mkuu mponyaji, tuombe kwa Mungu.
Thank you so much. You can remain seated. And welcome again to our second day of our 14th CUHAS Annual International Scientific Conference. Ladies and gentlemen, it's a pleasure to welcome you once again in Mwanza. I hope you are enjoying the environment and taking time to cruise the Lake Victoria. And on our second day, we'll have several presentations. And to start with, in our main hall here, we'll have the keynote speaker 3 and 4, whom I will introduce them shortly. But after the keynote speakers, they have given their speech, we'll have a session for discussion. Will be followed by a tea break, and then we'll divide in our 3 rooms. So we'll have the main room, and then we'll have on the ballroom on the 3rd floor of the Malaika Hotel, and also on the ground floor, we'll have another session there. So go through our timetable and pick where you want to learn more or where you feel more comfortable on the science. So with that note, I would like now to introduce our keynote speakers for this morning session today. So our first keynote speaker today will be Professor Gabriel Mkilema-Shilima, who is an associate professor of veterinary public health, specializing specifically on epidemiology of emerging and re-emerging infectious diseases, and with a special interest in One Health. He has a PhD from the University of Glasgow in the UK and a Master of Veterinary Public Health from the Sokoine University of Tanzania. But he's a trainer, mentor, and a supervisor of so many postgraduate scholars at the Nelson Mandela African Institute of Science and Technology in Arusha, and the AfriCUHAS scholar. He also serves as an adjunct professor at the Washington State University in the US. Before joining academia, he worked with Tanzania Vaccine Institute, producing several veterinary vaccines. He is a member of the Research Communication Subcommittee of the East African Science and Technology Commission, and also a board member of several institutions. Professor Shilima, in collaboration with other partners, including those from the UK, USA, and Tanzania, he managed to secure several One Health and animal health related projects, such as supporting the National Action Plan for Antimicrobial Resistance, precision livestock farming, brucellosis, and anthrax surveillance and diagnosis. So many other activities, because of time I will not go through all, but Professor Shilima has authored and co-authors more than 100 publications in reputable journals and conference proceedings. They can be available on the Google Scholar. If you go with that specific name, you will be able to. So may I now take this opportunity to welcome Professor Shilima.
Yeah, thank you so much for having this session for this morning. And I would like to take this opportunity now to welcome you for this second day. And now I'll start with a good greeting for this morning. Good morning, ladies and gentlemen. Before I proceed with my presentation, before I forget at the end, I would like humbly to acknowledge but also to appreciate an invitation extended to me from CUHAS to come and present some of my work and some of my insight on One Health as well as global security. And for this morning, I'm going to cover some aspects on One Health, but how it informs global security across the globe. I will start with this one. You might say we have an elephant, but what I want to describe here is each discipline is always honored. I really acknowledge and honor each discipline. I understand even as we are here, we have our own disciplines in different directions. But looking on the elephant, you could see those colleagues, but those colleagues are positioned in different areas. You might see someone holding the tail. And holding the tail in this sense, I consider is a single discipline, just focusing on the tail, looking at the size of an elephant, but someone concentrating on the tail, how the tail looks like, how long it is, and so forth. But someone is just touching around the stomach and trying to get the feeling of the size of an elephant. Someone is very close to the ear, try to see how it looks like and so forth, and try to describe. Someone is very close to the tusks. Probably you might think there's horns or rattle-like, but all these people, they might come up with different perception of how the elephant looks like. Now, if someone brings these people together on a round table, as we are here and trying to discuss, this person will try to coordinate, bring these people on the table. And through communication now, these people will try to describe how the elephant looks like. Someone will talk about the tail, the stomach, the horns, and so forth. But through this kind of communication and discussion, each will learn from each other. And that is part of capacity building. And once they understand from each other, now they might decide to collaborate together. Despite the fact they have a different direction, but now because of these ideas and these kind of discussions, then they will start now to collaborate. And once they start to collaborate, that is where now disciplines comes together. And that is One Health. Bringing people from different diverse disciplines, from the human health, from the wildlife, livestock, environment, coming together, collaborate together, and try to solve some of the issues that were considered to be weak and complex issues like an elephant, but later, once they come together, bring the ideas together, they might think, yes, it is a big elephant, but this is a solution altogether that we can take it forward. Thinking of those disciplines, if you talk about WHO, there are more of the medics. CUHA, livestock. If you go to UNEP, it's more on the environment and so forth. So bringing these big people together, sharing similar way of thinking, that is what yesterday Madam Mloka was talking about, one health system thinking. So in this regard, these are big organizations that have decided to come together, trying to address some of the weak, complex health problems that are facing the world today. And thinking of this, then we're talking of the pillars of One Health, and that is human health, animal health, and environmental health. And in this aspect, it means we need really to coordinate, to communicate, and to collaborate together so that actually we can manage these weak health problems that are facing the world today. Now, coming down to One Health, and going close to the global health security, based on the current literature, it says more than 1,400 human pathogens, 60% are zoonotic. But leave alone this one, of the 175 emerging infectious diseases, 75% are zoonotic. And out of these 75% which are zoonotic, 72% are considered to be of wildlife origin. And I just give you an example of the recent emerging infectious diseases that some of us actually could still bring roaming into our brains. This year we had cases here in Tanzania, very close to here in Mwanza. We have the Zika, we have the COVID-19, the recent one. We have the SARS. But leave alone that one, we have the highly pathogenic avian influenza A, that is H5N1, which recently has been reported in the US affecting dairy animals. You heard about this. But currently we are talking about Mpox. All these are emerging infectious diseases that originate from the wildlife animals, especially the primates and the other small mammals. So thinking of what I have just mentioned, there are some drivers that lead to the emergence of these emerging infectious diseases that we're talking about. I just tried to group them together. Probably later we can find a way to expand. We have currently the issue of globalization and environmental issues of climate change, movement of humans and products across the globe. It is becoming an issue right now. Someone can travel from Japan in few hours, is here in Mwanza. In 200 years ago, how many days someone could spend from Japan to Mwanza? Even though they contract an infection, even within the incubation period, actually even they might die along the way. But right now, you can contract a pathogen very far, but in the next morning, it is another place of the world. So globalization is an issue currently across the globe, but leave alone that one, we have issues related to social demographic patterns, the issues of poverty, inequality, lifestyle, as well as the human density, that's the population, urban migration, and so forth. We have issues related to public health systems, issues of AMR, IPC, vaccination programs. It do varies across nations. And in this case, these are the areas that we need to look so that actually all nations have to abide to some of the tools and guidelines that have been given by those quadripartite I have already mentioned, the four international organizations. But currently also we are observing pathogen evolution. My colleague yesterday was talking about genomic surveillance. These are the issues currently we need to look into. Now, looking on the global health security, what are we considering as an important aspect in the current world? Is just to think of ourselves if we are that secured. And if not, then we need to be that alert, and this should be across the globe. All nations, communities have to think about this. And in this aspect, basically, when we talk about the global health security, is to have a resilient world capable for preventing, preparing for and detecting and responding to global health threats posed by emerging and re-emerging infectious diseases, whether it is natural, accidental, or deliberate, in a more effective, rapid, transparent, equitable, and in accountable manner. So I've decided to put those three key items because these are also highlighted under the global health security agenda. Because we are talking about this natural transmission of this pathogen. But sometimes you might encounter accidental exposure, or even some of this could be deliberate or intentional. We have good examples in this, related to our lab securities and so forth, but also in some deliberate intentions. We might heard of the anthrax spores that were actually intentionally exposed through envelopes and things like that. Those are the things we need really to look into that when we talk about the global health security. We need to look into this in a broader perspective. When we talk about the global health security, we have the key three pillars, and that is we consider the term prevent, detect, and respond. And looking into this, I'll give more explanation into this. When we talk about the prevent, basically, we need to do the upstream approach, and that is preventing from the source, do active surveillance, but also to improve other surveillance systems that actually will make sure that we don't have a pathogen spillover or pathogen exposure getting to the human population. But once it gets there, then we need really now to do the downstream approach, and that is preparing to respond to what has happened to minimize the risk and transmission of the pathogens. When we talk about the frameworks and the guidelines, when we talk about the global health security, it's not just an individual activity or approach. This actually extends to the global call that all nations across the globe, they have really to look into this critically when they consider improving human health. And in this regard, we have different frameworks and guidelines that have been developed by those four organizations I've mentioned, the WHO, FAO, UNEP, and CUHAS. And we have what we call international health regulation. This focuses more on the human health, developed in 2005. We have the joint external evaluation exercises that have been conducted in different countries. We have also what we call the PVS, that is performance of veterinary services, managed by the CUHAS, that is the OIE. And also we have the One Health joint plan of action that actually guide the quadripartite on how to manage these wicked health problems. So based on what I've just put it here, I just try to summarize on how these frameworks, guidelines are related and how do they address the global health security. As I've already mentioned, the global health security is focusing on the preventing, detecting, and responding on these wicked, complex health issues. But now coming to the IHR, that is International Health Regulation, that is PVS and GE, actually they all address the global health security, and that is why most of the issues addressed here, they are almost similar, targeting to detecting, preventing, and responding to these wicked health issues across the globe. And in this regard, they tackle the issues related to zoonosis, AMWARA, and mainly on surveillance systems. also talks about capacity building, that is workforce development in all aspects, the human, environment, and animal, in order to make sure they tackle these wicked problems from the source. And now I would like just briefly to mention, when we talk about the global health security agenda for Tanzania, what has been done so far. In Tanzania, when it comes to global health security, there are several documents, frameworks, guidelines that have been developed in order to tackle or to address the global health security agenda. One of the documents that have been developed is the One Health Strategic Plan. And also currently we have the implementation guidelines, and this has been revised 2020 to 2027, and it is coordinated by the Prime Minister's Office under the One Health section. Leave alone that one, recently also we managed to prioritize major zoonotic diseases across the country. And some of these diseases also, they have prevention and control strategies. For example, the Rift Valley, the anthrax, the rabies, avian influenza, they have prevention and strategic plans in place. But also we have the National Action Plan for AMR. It has already been revised, and we have specific technical working groups addressing AMR from different perspectives, from surveillance, from diagnostics, from communication, community awareness, and so forth. But also in Tanzania, we have adopted the GE, that is the Joint External Evaluation, looking on how we manage to address issues related to global health security, and that is the prevention, detection, and responding to these emerging health threats. And in this case, we look on the policies, legislations, financing, but also the coordination and communication. And when it comes to detection, then we look on the laboratory systems, not only in the human, but also for the PBS, they look on the veterinary side, real-time surveillance, our workforce capacities, but also the emergency response operations. And that is why also sometimes we have these simulation exercises carried out in different places of the country to see how best we can respond to these emergencies. The same applies to the veterinary side, the animal side. We have the performance of veterinary services. We also look on the legislations and the policies, issues of financing, coordination and communication, our laboratory system to detect these pathogens and the real-time surveillance and the workforce capacities in different aspects of the veterinary side. But when it comes to the response, it's the same applied to the human side, and that is preparedness and emergency response operations and the issues of risk communication. So in this regard, basically Tanzania also has been committed to address all these issues under the global health security agenda, and that is why Tanzania has also committed to join in 2015, but also address the IHR, JE, and PBS. And currently we have the biosafety, biosecurity strategic plan in order to address some of the issues related to biosecurity issues, our laboratory systems, and so forth. These are just my home take message. To achieve sustainable health and food systems that get to reduce global health threats and improve ecosystem management, we may look into the following. One is to enhance One Health capacities to strengthen health systems. Two, reduce the risk from emerging and re-emerging zoonotic epidemics and pandemics. Three, strengthen the assessment, management, and communication of food safety risks, and curbing the silent pandemic AMR in both sectors. In this regard, then, we may address some of the SDGs, and that is number 1, 2, 3, 13, and 17. And in these 5 SDGs, we focus on the global health security, as we'll manage to cover most of the areas that actually have complex solutions and that needs different disciplines coming together and try to work together to address issues related to these areas that I have already mentioned about. Otherwise, pamoja tunaweza, together we can prevent, detect, and respond timely. Thank you very much for listening. Asanteni sana. Obrigado.
Thank you so much, Professor Shilima. You can have seated here in front. May I now introduce the second keynote speaker, Professor Gustich from the University of Wolfsburg in Germany. Professor Gustich is a professor of infectious disease and tropical medicine at the University of Wolfsburg. And he has so many assignments to tropical countries, including Tanzania, Zimbabwe, Somalia, Cambodia, and Angola. And recently, with reference to malaria, he has a long attachment to Tanzania, Massachusetts, where he did a lot on malaria in Zanzibar, but he also on several emergency Ebola mission in different countries, like Sierra Leone, Liberia, and more recently in the Democratic Republic of Congo. Professor Stitch, you are most welcome.
Thank you very much for the nice introduction. Good morning to everybody. As was told, I have a long-standing connection with Tanzania, not a very close one, but I've been to Bugando in the year 2008 for the first time. And when I climbed the Würzburg Road at the time, Bugando Medical Center was not a very inviting place. And look how it has developed until today. There are a lot of new buildings and a lot of new activities which evolved over the last couple of years. This was the laboratory in the year 2008, and today a lot of diagnostic tests and also research can be done in this place. This was the beginning of endoscopy in the year 2008, the endoscopy unit, and today, 16 years later, we have an endoscopy unit even at a district hospital in Nansio in Ukerewe Island. Medical studies started first with 10 students. Now this is the second term with 25. Professor Wilms from Würzburg University came frequently to Tanzania to teach medical students. He's retired now. He has quite some medical problems himself. But when I meet him in Würzburg, he always inquires, how is Bugando? So he lost part of his heart in this place. Today, we have hundreds, perhaps thousands of students in the medical faculty, but also in nursing and other medical disciplines. This is 2008 again, Bishop Balina from Shinyanga, and the visit of the Dean of the Medical Faculty of Würzburg, Professor Frosch, and the Medical Director of the University Hospital. And this was the signing of a memorandum of understanding 16 years ago, and Professor Frosch hasn't changed a bit, apart from he's looking a bit distempered, but now, 16 years later, he's crawling at the shores of Lake Victoria, looking for snails to do his contribution in the fight against schistosomiasis. Now, Bugando has evolved quite a lot, and I'm quite privileged to be as an outsider watching the development, and I congratulate you. You must be proud of what has been achieved, but this is not the end. It's even not the beginning of the end. It might be the end of the beginning. Bugando has entered the international stage, and now look at this conference, and I congratulate you of the main topic, One Health and Global Health Security. And I feel very, very honored to be able to have this talk to you now as an outsider coming from Germany and looking at the situation as an observer. Now, we all have gone through a terrible pandemic, more or less traumatized. Many of us have lost close relatives, family members, friends during the last couple of years, and it has changed our life, as you remember. Now, we were all looking at this strange new virus coming from nowhere, and I remember when the pandemic started, we were staring at those two humps. One was the rising incidence of COVID, and the other was the capacity of our health system. And we said, well, we'll be happy when this is all over, and we neglected the other major challenges which were threatening our situation. Now, from a German teacher's position, I hear often these assumptions. Infections are no longer important. People are dying of other causes. Infections can be managed. We have antibiotics, and climate changes happen all the time. Let us carry on with our business. And we know or we feel these assumptions are wrong, and they are totally wrong. And Corona actually showed us how wrong they are. Now, assumptions have to be tested. So let's go through those 3 points and look what is the truth or the failure behind it. Infections are not important. Well, 150 years ago, Louis Pasteur said, well, gentlemen, it's the microbes which will have the last word. And in Germany at that time, Robert Koch did his work. He discovered the cholera bacterium, he discovered the agent of tuberculosis, and he proved that, for example, tuberculosis is not a constitutional disease or coming from the air, but it is caused by a bacterium. And he even went to Tanganyika in the year 1906 to do research on tropical diseases, for example, on sleeping sickness. Now, since this time, we know that the more countries develop, the higher the socio-economic status is, the less important are infectious diseases as cause of mortality. This has something to do with development, but the development might have its side effects. And our lifestyle on a global scale is changing, and non-communicable diseases are playing a more and more important role. And when you do ward rounds in Bugando, you'll see it. You see malaria, you see TB, you see HIV, viral hepatitis, but you also see a lot of stroke, hypertension, cancer, chronic lung disease. The chief medical advisor of the President of the United States said one day, it's time to close the book on infectious diseases and declare the war against pestilence won. Because we have antibiotics, we have vaccination, we have hygiene. Well, we know it's not true. Just look at the Ebola situation, or more recently it was mentioned, the Marburg virus outbreak in Tanzania, but also now in Rwanda. It's fortunately over, but the Mpox in Congo and adjacent countries. But when there is one case of Ebola, or thousands of cases in Ebola in Africa, in the rest of the world, nobody seems to care. Phenomenon of infection, and it starts even in the intrauterine phase already, and the most dangerous day in the life of a human being is day number 1, the day of birth. There statistically most people can be managed, we have antibiotics. Now the neonatal mortality rate, for example, is the highest in the low-income countries. And infection in the first 4 weeks of life play a very important role, especially neonatal septicemia. The most serious infection in early life is lower respiratory tract infection, and we know that the socio-economic status of a population is related to the case fatality rate in this kind of disease. Septicemia, bloodstream infections, are a main cause of death, and again, in those countries who have least access to both antibiotics and intensive care units. For example, intensive care units are nearly lacking in the countries where they are most needed. Global mortality is associated with lots of things, but also with bacteria. And again, sub-Saharan Africa is the area in the world which suffers apparently most. And also, in these countries, we have the least access to antibiotics. We have the highest mortality rates and also the highest rates of antimicrobial resistance. Antimicrobial resistance is everywhere. It is on skin wounds, it is in gut infections, bloodstream infections, urinary tract infections, wherever you look. And the death rate of cases attributable to antimicrobial resistance is nowadays higher than those in HIV, the most important cancer disease, breast cancer, or malaria. So it is really something glooming at the horizon which needs our attention. Here again, millions of people are supposed to die in the coming years due to the results of antimicrobial resistance. And the bacteria which are the most important are Escherichia coli, Staphylococcus aureus, then Klebsiella for the neonates, and many other bacteria. And the diseases which are the most important are lower respiratory tract infections and followed by others. Sub-Saharan Africa are the green bars, and you see that the death rates per 100,000 population are the highest in the continent which has the least access to antibiotics. TB is a similar story, and I'm not only talking about pulmonary TB, which everybody knows, but also the extrapulmonary TB. And again, we have a worldwide problem of drug-resistant tuberculosis, especially multi-drug or even extensively drug-resistant tuberculosis. And the rates of MDR-TB, of course, can only be measured when we have means of diagnosis. And in many countries which need this kind of tool, the resistance testing is not sufficiently available. So perhaps we have even higher rates of MDR-TB as we can measure at the current stage. Now we have to pay really attention to the development of infectious diseases. It's a dynamic field because we are dealing with living pathogens which are under the stress of evolution, which change over time, and we have to adapt. And therefore I really provocate the need for anti-infective stewardship, which means engagement in preventive medicine, vaccination, and especially hygiene, and curative, which means the rational use of antibiotics. And I'm really prepared to phenomenon of our days and on number one, climate change. We in Germany already witness examples. In Africa, they get infected and they either die or they get immune and return to Germany as immune stocks. Now, in the case that less and less stocks are traveling, and the same with other species of migratory birds, there is a rising population of non-immune animals giving an entry point for the West Nile virus. And this was happening. These are case numbers in Europe in the last years until the year 2018, when we had a sharp increase in cases, and at that year already West Nile entered Central Europe. And today we have in Germany a lot of areas where West Nile is already getting endemic. And this year, 2024, we had about 40 human cases in my country. So this is already the beginning of the spread of a tropical virus into temperate areas into Central Europe. And as I said, West Nile is transmitted by mosquitoes, local vectors, and the warmer it gets, the higher the transmission rate, the higher the replication rate of the virus in the mosquito, and the more efficient transmission becomes. Now this has to do something with temperature, apparently, and temperature on a global scale is rising. It is certainly man-made, and it is a very simple concept. It's the concept of the greenhouse. Radiation is entering, is getting reflected, and it's heating up the atmosphere due to the greenhouse gases, especially CO2, but also others. So it's getting warmer, and that means we have rising temperatures, we have more weather extremes, and we have rising levels of the sea. And this can be translated to other phenomena of medical importance, and they are numerous, not only infections, but also, for example, just heat. Heat can be dangerous, especially to vulnerable people, elderly, and people with cardiovascular diseases. So our cardiologists have to know that we have excess mortality during heat waves, especially in the southern countries of Europe, but also in Germany. Or we have an increasing air pollution, which means that chronic lung diseases and also pulmonary infections are getting more and more frequent. Now this is a tiger mosquito, Aedes, hasn't survived, but it might have already transmitted whatever it has had in the saliva. So let's look at the vectors, the biology of the vectors, the vectorial capacity, and the specifics of the pathogen, the factors of disease transmission. Aedes albopictus, the Asian tiger mosquito, is spreading all over the world, and it's spreading through tires, which are distributed as part of a global tire trade all over the world. So with the tires, the Aedes mosquitoes came to the Mediterranean, established stable populations in the north of Italy, and then went towards the north. And today We have them already in many parts of Germany, and since last year, even in my hometown, Würzburg. So things are really changing. And looking at the Aedes populations in the last years, nearly the whole of Germany and parts of Central Europe are already invaded, which means that there is a potential risk. At the moment, we have in Germany only imported cases of dengue fever, but we had as many as never before. So in the year 2024, in July, we already had more cases than we ever recorded before. So there is a lot of change, and this not only applies to dengue, but also to chikungunya, Zika, and other viruses. Now, we have two phenomena. We have increasing temperatures, which facilitate replication of the viruses, and we have the invasion of new species, neo-invasive species like Aedes. And here you see not only an Aedes mosquito, but also two people which are very close to me. My wife, which has been to the conferences last year and the year before, and she's my teacher in planetary health, and one of my children, and it's about the children we have to really start thinking of the consequences of what we are doing. Sorry, kid, but thanks to my selfishness, you will face unspeakable suffering from climate change during your lifetime. Are there any good news? Yeah, I'll be dead by then. And this reflects that we are talking not about us, but about our future generations. People which are born today will encounter the consequences of climate change during their lifetime, and the earlier, the more we have this climate change. And therefore, we have to take over responsibility not for our well-being, but for the well-being of future generations. Let's talk very briefly about malaria, other mosquitoes, and usually we teach our students the life cycle of the parasite in the human body, and we explain the pathology and what can be done about it. But we usually neglect in our teaching the part of the life cycle in the mosquitoes, the so-called sporogonic cycle. And this also has an incubation time, because the parasite has to develop in the mosquito from the gut to the salivary glands, and this life cycle is highly dependent on temperature and humidity. Example from the last year's World Malaria Report for Pakistan. Pakistan had every year waves of malaria epidemics in the country during the rainy season. In the year 2022, there was heavy flooding, and malaria cases went up tremendously, and since then stays on a high level. Now these weather extremes will become more frequent. This is a picture just 3 days ago from Ukareve Island, and we all in the whole world will experience more of these weather events in quantity and intensity in the future. This means that climate change will depress agricultural yields in the next years to come if we do not change. And looking at the temperatures trend in Africa, we see that there is a clear upward trend. And this affects a continent which in the coming decades will have the largest population growth in the world. And this is not due to the fertility rates of African women, it's due to the fact that the population is getting older, and therefore the whole quantity of people is on the rise. And that means that these factors lead to migration pressure. People will migrate, will have to leave zones which are uninhabitable and have to move to other areas. Now, planetary health is a relatively new term. It evolved from both roots of epidemiology and infection hygiene, merged with global health, international health, and eventually came to the science of health of the human civilization and the natural system on which it depends. And currently we are facing a triple crisis. It's not only the climate change, which happens all over the world. Thank you. But also the pollution. This is a picture from the shores of Lake Victoria, and the loss of biodiversity, and therefore the deprivation of natural resources, also, for example, for the development of new drugs. There are the tipping points, the points of no return, and we can talk about every single one, but just one example, the Amazon. This is a picture from Peru. The tipping points calculated are reached when we have about 2-degree temperature increase and a 24% deforestation, and today we already have 1.2 degrees temperature increase and 70% deforestation. So we are getting close. This means that the young generation might be in despair. What to do? What can I do as a single person? Or it is already too late, so why continue living at all? It's denial, repression, doomsday and fatalism. It's the feeling of having no future. And this is not a message we should convey to the young generation. There's a lot of pressure now, and this reminds me to the toad trial. If you put a toad in hot water, it will jump out. But if you put a toad in cold water and set fire underneath, it will miss the moment to get out in time and die. And this is a bit the situation of human civilization today. We know a lot about climate change. We can measure it. In fact, science has all the facts on the table, and we have to move to action. And this is something which we have to do now. And working for solutions means transformation. In the health sector, we can use this example. Health is a cricket play, and the population would like to be part of it. Now there are sick people, and their view to the cricket field is obstructed, and our health system helps them to be part of the whole game. This is equality. Now, equality means provide the main resources to everybody. And you see, this might be unjust. The reality is that some people have a lot more than they really need, and others are deprived. So equity on health means what we have to achieve, not to give the same thing to everybody, but to differentiate who needs most. There are many good news. For example, the life expectancy is rising. Never in the area of the Homo sapiens did people live for so long. And even in Africa, life expectancy is on the rise. It's about more than 70 years today. This is Gapminder, and every bubble is a country, and every color a continent. Africa is blue, and it shows the relationship between income, between socio-economic development and lifespan. And we can be proud of it because these bubbles are moving towards the upper right area of the graph. But this comes with a price. The price is more emissions, the price is ocean destruction, energy use, tropical rainforest loss, water use, fertilizer use. And also the population is growing. Now it will stabilize in a couple of years at around 10 billion people. It means that we have a higher need for food and for water. Most people are floor moppers. They try to clean the floor, but they are not turning the tap and repairing the sink, the actual cause of the problem. And we are running a bit out of time. Still, we can mitigate, we can prevent the unmanageable, we can prevent the tipping points of the planet, but in a few years' time, we can only adapt, because with the tipping points, we have a dynamics which is unstoppable. contribution to alleviate the situation. Live your life well, so we don't have to lie at your funeral. It's one of the churches here in Mwanza, but it shows we have to really play our role in the current game. And we have to focus on solutions, and solutions are interdisciplinary. Quite complicated at first glance, but achievable. For example, just adopting clean cooking. The traditional way of cooking guideline to climate-sensitive health advices in medical consultations. So how to address climate issues in our patient-doctor relationship. And of course, these guidelines cannot be translated into Swahili because they are adapted to the situation. Develop your own guidelines. Do this in a way together. Addressing the really global only be done in a mutual concept. And this reminds me to the part of a global community, and to address and respond to the challenges of today's world. We can only do this by working together. And this is one of the impressions I take back when I return to Germany tomorrow, this conference and of the contacts I had. And I'm really very, very grateful So asanteni sana, and thank you very much for that.
Thank you so much, Professor Stitt. You can have a seat. I can see a lot of quotations from the two presentations already on our social media. So that means the individuals are really engaged in the scientific work that's happening here at the Malaika Beach Resort. So may I now welcome delegates, participants for your contribution, questions. So you can raise up your hand and our team will reach you with the mic if you don't have one. But you can use the nearby microphone. So you can direct the questions to either Professor Stitch or to Professor Shilima, or a general contribution to both. Yes, we have. Go ahead, Prof.
Thank you so much for both to both presenters for very nice quiz speeches. I have just one concern. The main focus is all about One Health and the global health security. But why did you choose specifically to focus on One Health and the infectious disease, not accommodating non-communicable disease? Are they not part of the One Health? And in this aspect also, I would wish to hear if there is any association between One Health and food and food security in concepts of fighting with non-communicable disease from nutrition perspectives. Thank you.
And your name, please?
Sorry?
Your name, please?
Yes, I'm Obadia Nyongore. I'm working with MUAS.
Another question, so we collect a couple of questions before we give them. Yes, there's a hand there.
Yes, thank you so much, Chair, and I also congratulate the two presenters. All the presentations have been very nice, but I have one small question to Professor Shirima. We have been having this concept of One Health for about a decade now, or even slightly more. But every time we discuss it, every time I discuss it, my colleagues, they say, we hear about One Health, but we don't see it happening in the ground, at the ground. Now, could you highlight the challenges, particularly in our African countries? Why is it that we are hearing very much One Health in the conferences, in the big, like the tripartite organizations you mentioned, but down in our communities, we are not finding it. What do we need to do to get One Health happening down in the ground? Thank you.
Your name again, please?
Dr. Safari from Nimbi.
Thank you. Any other question? If not, then we will allow the two professors to respond. Yes, Professor Shilima.
Yeah, thank you, facilitator, and I really appreciate for those colleagues who have tried to raise some of the issues related to One Health. The first one is the issue of non-communicable diseases, not part of what you have presented. I really acknowledge your question, and I want to tell you, if you get to our One Health strategic plan, non-communicable is part of it. And if you get to the international health regulation, it also talks about other hazards. It is also part of it. But also, when it comes to One Health and food security, I want to assure you also food security and food safety is part of the pillar of One Health. So even when I talk about sustainable development goals, I mentioned the issue of food security, issue of poverty, and so forth. So it is also covered. Probably I didn't just put more emphasis into that, but if you get to the documents, it is well covered. My colleague mentioned that yes, more than a decade we have been talking about One Health, but you don't see much getting down to the communities and so forth. I want to tell you, even before this term One Health, we had this informal kind of collaboration, people working together, try to address some of the issues related to One Health. I really appreciate the work done by our former colleagues who have been working on One Health for decades without even having these formal documents that we are talking today. And even getting to the communities, there are issues, if you look critically, actually they are related to One Health, though they are not that formalized. But now coming to the era of formalization, getting down to the current documents that we are talking about, basically whatever we are talking about One Health, it has to touch the community. As we all know, all these emerging health problems, they start from the community. But now it ends even at the community. So it's all about the community that we are talking about here. It's the same when we talk about the global health security. It's just to protect the community's health. So in this regard, basically, yes, I do understand when it comes to the structuring and all these formal structures, we really need to move more at the community level for people to understand how to work together, how we can invest together to address some of the challenges that are facing the human health, livestock health, environmental health at the community level. So this is what I could say at this point, that basically One Health is all about community health, addressing people who are the community. Thank you.
Thank you so much, Professor Shilima. And now to Professor Agstich.
Yeah, thank you very much. And the major messages I would like to give in response to the questions is, first of all, what we are talking about, be it One Health or planetary health, is not the way how we traditionally teach medicine, or we talk from one disease to the other, from one organ to the other. We cannot put the problems into single drawers. We have to use an interdisciplinary approach, which is multidimensional, which is much more complicated to comprehend, and where we need a lot of input from other sciences and other people apart from the medical issue. But it is also a very important medical issue. That's one thing, interdisciplinarity. And the other thing is we have to realize that every one of us is a major contributor and can do a lot. As an individual person, you can already question the three main pillars of change, which is nutrition, energy, and mobility. And then on a level of a community, on the level of a country, on the level of politics, you can also address the same kind of problems, but on a different scale. So let us just start thinking of ways how we can transform, because I don't want to give rise to panic, but we are running out of time. And you in Africa will experience the consequences of what we have done in the global north over many, many decades much earlier than we, because your situation is less resilient. So the solutions of the problem only can be in a global approach, and I'm a bit scared of the future developments in the world, looking at recent elections in other continents, so to speak. So let us just not stop our way forward, because we should actually address a global goal.
Thank you so much, Professor Gustis Stich and Professor Mkilema Shilima, for your nice presentation and discussion. Now we know, but the big question remains, can we do it? So having said that, we'd like to join our hands to thank you, Professor Shilima and Professor Gustich, for your time and for being available this morning. Can we clap hands for them, please? So I'd like to make a few announcements. So after this plenary session here with the keynote speakers, so we'll break for tea, and then we'll resume at 10:30. And when we resume, we'll break into 3 rooms. So the main room here, we'll be having a session on pathogens of public health importance, surveillance, epidemic control, and the global health security, available on page 4 for our timetable, and they will be chaired by Professor Jeremiah Seni, Dr. Anton Liwa, and Professor Benson Kidenya. Again, on the ballroom on the 3rd floor of the Malaika Beach Resort, we'll be having a health system and a global health security that will be chaired by Dr. Evelyn Konje, Dr. Joseph Mwanga, and Dr. Emanuela Ambrosi, together with Dr. Anthony Kapesa. This one is available on page 5 of our timetable. And on the ground floor of the Malaika Beach Resort, we'll be having our satellite session on hall number 3, where we'll be looking on basic biomedical research and the global health security. This session will be chaired by Professor Yacinta Jaka, Mr. Deo Katabalo, Dr. Igembe Mkandala, and this is detailed on page 6. So having said that, you are now welcome for our tea break, and we'll resume at 10:30. So remain seated while we announce the procedure for the tea break. So we'll start with our VIP 1 and 2, please, followed by directors and deans, and our EKC on the lefty buffet. And then other distinguished guests, ladies and gentlemen, will use their buffet on the mid and on our right. We remain seated while the VIP 1 and 2 then the EKC on our left. And the executive for